recording. They did
week or
Alex's
so
as
ago,
well.
and they did,
So
yep.
that's right.
So I
I
think
think we're good.
Yep.
Okay.
Great.
All right. Are we ready up top to go ahead and start? Okay, we'll go ahead and begin. I know we may have some people trickling in, but we'll go ahead in the interest of time, get started on time. But first and foremost, by way of introduction, my name is Richard McAlinden. I'm our Assistant Superintendent of Executive Services with the Placentia-Yorba Unified School District. And I want to start by welcoming our families who are in attendance today, and then, of course, those who are watching tonight's presentation via live stream. Just a couple quick kind of housekeeping notes. First and foremost, the presentation tonight is being recorded and will be posted on the district's website to make sure that it's readily available for families who maybe weren't able to watch at home or in person. It will be made available to families once the presentations are completed. We also very much encourage our families to share the recording with others. We're going to post it on our website, but this is a community effort, so the best we can do to get the word out there once we have that presentation, if you know of families, neighbors, anybody that maybe didn't get a chance to see the presentation, we would encourage you to pass it on to them. Now, before we begin, I'd like to thank our partners from the City of Placentia, certainly Damian Arula, our city manager. He'll have a chance to talk to you in a few seconds. But I just wanted to thank our partners from the city, as well as our law enforcement partners for their dedication in combating fentanyl use in our community. This is really a one-of-a-kind, comprehensive partnership that we're proud to be a part of. On the prevention side, we have completed our student assemblies at our 5 high schools, our 4 comprehensive high schools, as well as El Camino, really wanting to invest in the educational part of this to try and help with the prevention side. In January, our middle schools, our 6 middle schools across our district, will also receive a similar presentation from law enforcement, really trying to educate our students on the dangers of fentanyl and what to look for and how to avoid it. On the emergency response side, it's not just about the education part of it. Hopefully, if the education is really good, you're having fewer and fewer incidences, but we do know that we need to be prepared in the event that we have to respond to an emergency on our school campuses. And to that end, we have added Narcan to every middle, elementary, and high school campus, and we've trained over 400 staff members at our school sites on how to administer and access Narcan should we have an event on one of our campuses. We're looking this year to grow that number exponentially in the second half of the school year. And I would really be remiss if I didn't thank our school nurses for their help in training our staff, as well as Lynch Ambulance Services for their help in this area as well. They're partnering together to make sure that those that are interested in being trained on the administration of Narcan have that access to them. It really, truly takes a community effort in this fight. So I hope you see that partnership, and we'll continue to make efforts in that area. We hope you find the presentation tonight beneficial, and we hope that you spread the word to others as we fight fentanyl use together. So with that, I'd like to, I know Damian wanted to say a few words just to greet those that are here tonight, as well as those that are watching online. So with that, Damian Arula.
Thank you, Richard, and thank you again to those that are in the audience tonight, as well as those that are watching at home. I know a lot of folks couldn't be here tonight, and because they are working families, so we wanted to make sure also that we provided that opportunity and are live streaming it. So thank you to the school district as well, and the staff that are also filming this here tonight. We also wanted an opportunity to upload these to YouTube, so our plan is to present these on both the city's and the school district's YouTube sites, so those families that couldn't be present tonight or couldn't even watch it live stream will have an opportunity to view it at a later time. Really, the goal of this process, as Assistant Superintendent McAlinden had indicated, is really partnership between the city and the school district in trying to get the word out about fentanyl. It's the #1 epidemic that we're facing in our time, not just for children, but also young adults, adolescents that we're seeing. A lot of these, unfortunately, these deaths go unreported. And we are seeing this happen even in some campuses. We're also seeing it in other areas of the community. And so after hearing about that this was really not being approached in a proactive way, the city and the school district. It's rare that we always get a chance to partner on something in a common area, but this is one that we both felt very important, partnered in, and began a series of meetings and the presentation that you're about to see here tonight. In addition, I just wanted to also mention that we appreciate the support that we have from Dr. Alex Chernis, the superintendent, my colleague here at the school district, as well as the entire school board for supporting this effort, and the city council of the city of Placentia. Our mayor, Ward Smith, is actually in the audience here tonight, has been attending these meetings consistently for the last few months as a part of our team. And we hope that you find this information very helpful tonight. Our goal ultimately is to empower you with information and education, some things that even we learned along the way about fentanyl and some of the things that are happening, and ultimately so that you can have these conversations with your kids and make sure that you're educated and can be aware of the dangers that are occurring in real time in our community. Our goal together in our partnership between the city and the school district is ultimately tonight to save lives. And we hope that by this education that, and we may never know this together as families and as community partners, but is ultimately to save lives. And there's even an example that our Sergeant Bo Wagner will provide in which we've shared with both school district staff as well as all of the children that we've had these assemblies at, to really give a real-world example of how even some of the best kids, the kids that we think oftentimes would never approach fentanyl or never do something like that, can actually succumb to the fatality of a situation of fentanyl. So with that said, I'll turn it back over to Assistant Superintendent Macklin.
Thank you very much. Thank you, Damien. And if you, again, one other just quick note is that the same presentation will be offered at Valencia High School this Thursday night. So for those that you run into that say, darn it, I missed it, I meant to go, I wanted to go, there's another opportunity this Thursday night at Valencia's auditorium at 6:30. So pass the word on about that. That would be great. That's done. That was last night.
Oh, perfect.
Yeah, I would mention that this is actually the second of 3 presentations. Again, this was number 2. Number 3 is on Thursday night. But last night we had a presentation, Spanish-speaking, for our Spanish-speaking families over at the Oberly Gym near Melrose Elementary, and that happened last night. So really an effort to try and hit all areas of the city to make sure that everyone who wants the opportunity to attend has that opportunity. So this is the second of 3 presentations, with the third one being at Thursday at Valencia High School. So we're hoping those that missed tonight have that same opportunity. So with that, I'd like to turn it over to someone that we've gotten to know very well over the last couple of years, a former school resource officer with us, but he's recently been promoted to sergeant. I'm real excited for him, this opportunity, but he remained committed to this project and said, I want to see this through and make sure that we do everything that we can to help with this issue. But if you'd start by having maybe a warm welcome for Sergeant Wagoner as he gives the presentation tonight. Thank you.
All right, thank you, gentlemen. So my name is Bo Wagner. I'm a sergeant with Placentia PD, and up until a couple weeks ago, I was the school resource officer at Valencia High School, okay? And I'm here to talk to you tonight about fentanyl, and I'm here to present FAIR, or Fentanyl Awareness, Information, and Reduction Initiative. Before we get into fentanyl and why it's dangerous, I want to introduce you to somebody. This young lady here is Trinity Cornejo, okay? And last year, she was a senior at Troy High School. Friends and family have described her as a great kid, okay? She was an awesome softball player, numerous all-star pins. She was a great student, and she was described as a great listener, generous, accepting, outgoing, and a fierce protector of the underdog. She also cared deeply for her family, and particularly her younger sister. And here we have some photos of Trinity with her family. Okay, so brings us to September 30th of 2022. So Trinity's mother, Krista, had always warned Trinity of the dangers of fentanyl. Now, Trinity wasn't described as a rebellious teen or a drug user of any kind. She was always home for her curfew. But on September 30th, 2022, Krista dropped Trinity off at a friend's house for a party. Okay. Trinity and her friends decided to purchase M30 pills. Okay, M30 pills are basically oxycodone pills, prescription pills. But they decided to purchase these M30 pills from a dealer on Snapchat. But Trinity was the only person in her friend group that took the pill that night. Okay, so shortly after she took the pill, her friends noticed that Trinity was what we call on the nod. Okay, this is basically a slang term for someone who might be falling asleep because they are under the influence of opiates. So they sent Trinity home in an Uber when they noticed that she was on the nod. Okay, after arriving home, she was preparing to go to bed, but she was soon discovered unresponsive in the bathroom. EMS was called, and she was taken to a local hospital, but she was later pronounced deceased, and the coroner determined the cause of death was opioid poisoning. Okay? Now, we will come back to Trinity's story shortly. But first, I want to give you some statistics that we pulled from the DEA as well as the CDC. We had over 107,000 total opioid-related deaths nationwide last year. Okay? 68% of that number was due to synthetic opioids, mainly fentanyl. And 151 teens died from fentanyl overdose in California alone. Okay? Two things to point out that are important. Number one is that it's not just drug addicts who are dying from fentanyl. Okay? And number two, 151 teens. That's just the ones that we know about. Okay? Those are the ones that we can definitively tie to fentanyl. That number is likely even greater. Okay, so what is fentanyl? So fentanyl is classified as a narcotic analgesic. It's in the same class of drugs as things like heroin, hydrocodone, and oxycodone. And it's actually legally used to treat patients with severe pain. Okay? It's used in medical settings like hospitals. Paramedics have them in the ambulance with them. So it is actually legally used in the medical field to treat pain. But we're here today to talk about illicit fentanyl. Okay? This is fentanyl that is manufactured and sold illegally as a street drug. Okay? Now, fentanyl is about 50 times more potent than heroin, and it's also much cheaper to buy and it's cheaper to make than heroin. And if I can direct your attention to that little pile of dust next to the penny, that is a lethal dose of fentanyl for the average person. It's equal to about 2 milligrams, okay? Not grams, milligrams, okay? So very, very small amount can potentially kill the average person. Okay, so again, we have a lethal dose depicted, this time on the tip of a pencil. But more than half of the illicit fentanyl pills seized by the DEA contain a lethal dose, okay? And the DEA seized almost 60 million of those pills last year, okay? That's a lot of people that could potentially be harmed by these pills. Okay, so teens are at risk, okay? There's a couple specific reasons why teens are at risk here, okay? Number one, fentanyl can be laced or mixed with other drugs very easily without detection, and it can come in colorful pills, giving the impression that it's harmless, okay? It's just another party drug. You don't have to worry about it. But fentanyl-related deaths were the #1 killer of kids under 18 in 2021. Okay, that wasn't car accidents or alcohol-related incidents. It was actually fentanyl that was killing the most young people. Okay, so here we have some pictures of some pills. On the left is the authentic prescription pill for that particular drug, and on the right is an illicit pill containing fentanyl. okay? And as you can see, they look pretty similar. I've actually showed these photographs to paramedics and other medical professionals, and they said that if they were to look at one of these pills without the context of, hey, this is actually a fake pill, they would not be able to tell the difference, okay? So that's how similar these fentanyl-laced pills look to the real thing. Okay, so here is a photograph of some pills that say M30 on them, okay? So these are the oxycodone pills that I was talking about earlier with Trinity. But as you can see, all of these are very bright and very colorful, and the reason that they are this way is because they want to, the people who are manufacturing these pills, they want to appeal to teenagers and young adults, okay? Kind of looks like candy, doesn't it? So that's the reason that these pills are so bright and colorful. It's specifically so that they can attract young people, teenagers and young adults. Okay, another thing that is becoming a trend is actually fentanyl-laced vapes, okay? This is a trend that's on the rise, and it's a big problem for teenagers and young adults, especially under the age of 21, because they cannot go to a tobacco shop or wherever and legally buy a vape. They have to depend on somebody who's willing to sell it to them illegally, okay? And what they're doing is they're placing a lot of trust in that person who's selling it to them because they're trusting that this person is selling them what they think it is, which is just a nicotine vape, okay? But what happens when this vape dealer, if you will, gets the regular nicotine vape mixed up with a vape that he has laced with fentanyl? Unbeknownst to the person who just bought it, they are now about to smoke potentially a lethal dose of fentanyl, so we could run into a problem there, okay? When these vapes are laced with fentanyl, it's always after the initial manufacturing process, so they're not regulated. The concentration of fentanyl is unknown. It's just however much fentanyl that person decided to put into that device, okay? And if you're going to inhale fentanyl rather than take it in a pill and digest it, inhaling or smoking it is going to have a much faster and more intense onset of symptoms from the opiate. Okay, so drug dealers are using social media to target teens, okay? And they actually will put up on their, Snapchat stories or Instagram stories or whatever, they actually put up code words and emojis that basically advertise for the sale of narcotics, okay? And what they do is they disguise their illicit fentanyl pills, okay, pills that they have manufactured specifically with fentanyl. They're disguising those pills as legitimate prescription pills, okay? And they're going to claim that they are selling Percocet, Xanax, Adderall, sometimes even over-the-counter stuff. But what they're actually selling is an illicit fentanyl pill that could contain a lethal dose of that narcotic. So when someone makes contact with them saying, hey, I want to buy some of your product, the first thing they will typically do is try to move that conversation to some type of encrypted messaging app, so something like WhatsApp or Signal or whatever. And the reason they do this is because they know it's harder for law enforcement to track their conversations when they're using these encrypted messaging apps, okay? And they're also going to try to request payment through things like Venmo or Cash App or these one-tap payment methods, okay? Now, these are some of the emojis that we have been seeing on these stories that are advertising the sale of narcotics. There's a whole lot, and it's changing all the time. They're using different emojis to describe different things. This is just what we were able to get as the most recent emojis that we've been seeing. The ones that typically tend to stay around are going to be this one over here, the plug, okay? This is basically like, hey, I'm the plug, or otherwise, I'm the dealer, okay? I'm your source for drugs, okay? There's a few others that will probably stick around, but we're seeing new ones pop up all the time. Okay, so up top here, these blue pills, these are also M30 pills, and they are colored blue. This is actually what the pills are supposed to be colored as, but these pills are actually illicit fentanyl pills, okay? And the only way that you would ever know that without taking it is if you send it into a laboratory for testing, okay? There is no other way to know exactly what that pill is, okay? And that's why these are becoming so dangerous. Okay, so recognizing fentanyl use. There are 4 main ways of administering fentanyl, okay? We have inhaling, snorting, injecting, and ingesting pills. Okay, so when someone's going to smoke an opiate, such as heroin, or maybe a fentanyl pill or something like that, they're typically going to do it using tinfoil, okay? What they do is they put the narcotic on the top of the tinfoil, take a heating source from the bottom, they heat it up, okay? It starts to emit the fumes, right, because they're burning it on the foil from the bottom, and they use a straw device. Sometimes they use like a pen that they've hollowed out, but this device over here that they're going to use to inhale the fumes, they call that a tutor, okay, but it's usually just like a straw device or maybe a pen that's been hollowed out, okay? So a good telltale sign that somebody's been smoking opiates off of a piece of tinfoil is going to be the black burn marks that are left behind on the foil, okay? That's the most common way that you're going to see that somebody's been smoking something off that foil is the black burn marks, and you can see it kind of drags along the length of the foil like that. They kind of have to move the narcotics along and keep heating it and burning it up and then inhaling the fumes through the tutor or the straw device, okay? Okay, so another way is by snorting, okay? So they can either crush pills up into the powder and they can snort the powder, or fentanyl actually can be manufactured as just a powder and you can snort that as well, okay? But the powder will usually leave behind fine residue, and when they are snorting it, they're typically going to use a dollar bill or maybe some type of paper or maybe even another straw device or something to snort the narcotics into their nose. Okay, there's also intravenous use, okay? This is when you are actually injecting the narcotic into your veins, and this is typically we only see people using intravenously when they're pretty far along in their addiction. Most people don't want to inject themselves with needles, but if they are addicted to the point where they're looking for that experience, then they might try intravenous drugs. The syringes on the left here, this is the most common type of syringe that we see on the street. Used to see these a lot when heroin was pretty big. Not seeing too much heroin anymore, but if we do see syringes on the street that are used for intravenous drugs, it's going to be these ones on the left here, okay? Now, one thing that I found really concerning is that there are very detailed instructions on how to use intravenous drugs on the internet. You can just Google search it, and you will find multiple websites that will have step-by-step instructions on how to use intravenous drugs, okay? So if your child has a cell phone, they have access to the internet, they have access to that information, okay? I found that pretty concerning. They even have pictures along with the step-by-step instructions on how to actually inject yourself with intravenous drugs, okay? So I found that pretty concerning. Okay, so early signs of fentanyl use or possibly even overdose, okay? Slow to little breathing, drowsiness or unresponsiveness, constricted or pinpoint pupils. Basically, what is happening is the body is going into what we call a parasympathetic response. Okay, this is opposite of a sympathetic response or a fight or flight response. Okay, so we have fight or flight, right? This is when the body perceives some type of threat and it's preparing itself to address that threat. Okay, and it's going to do things like dilate your pupils, right? It's going to make them bigger, let more light in, makes you see better. Okay, it's going to increase your heart rate and increase your breathing rate. Okay, it's also going to start flowing blood to major muscle groups like your legs, right, to prepare you to either run or to fight. Okay, opiates, including fentanyl, they do the opposite. Okay, they bring things down. Okay, constricts the pupils, slows down the heart rate, slows the breathing rate, makes them drowsy. Okay, just remember that fentanyl and opiates bring you down. Okay, so it's important to note that there's a whole lot of things that are happening in your brain when you're using narcotics, even opiates, but we're going to cover the basics, and we're going to cover the basics of addiction, okay? Quick show of hands, who here has heard of a term called dopamine? Anybody? Yeah, a couple hands, okay, cool. So dopamine is the brain's reward system, okay? And basically, this is the brain's way of ensuring that certain behaviors are repeated, okay? So when you do things like you read a good book, watching a movie that you really enjoy, anything like that, your brain is going to release a small amount of dopamine, okay? And what dopamine does is it actually makes you feel good, right? Gives you like a little sense of pleasure, okay? When you use things like opiates or other drugs, what you are doing is you are tricking your brain into releasing a lot of dopamine, right? More than it should be releasing, okay? The cells in your brain have things called opioid receptors, okay? And this is because your body actually produces its own opioids, but they're very, very weak compared to things like fentanyl and heroin, okay? But outside opiates can still bind to your opioid receptors. And when that happens, it releases an incredible amount of dopamine, okay? So now this person has used fentanyl, okay? And now their dopamine levels are extremely high. They're way up here, right? But the body wants to maintain homeostasis. So after a while, the opiates are filtered out, okay? And the dopamine levels will plummet, okay? And most time they will even go down further than they were at baseline, okay? And when they're down here, when the user's down here, all they want to do, all they can think about is being back up here, right? And especially with opiates, the addiction is formed very, very quickly because of the amount of dopamine that is involved here, okay? That experience of them being way up here is very powerful, okay? And they want to return to that feeling when they're up here, okay? So in the beginning of the addiction, when they're up here, they feel great. When they're down here, they feel not so great, and they want to use again. And when they use again, they come back up, and before they know it, they're in this vicious cycle of being up and being down and being up and being down. Before they know it, their new baseline is actually up here, right? When they're under the influence and the dopamine levels are very high. This is their new baseline. And when they're down here, all they want to do is be back up, okay? This addiction is so powerful that I've spoken to a lot of drug users in my years as a police officer, and many of them will choose drugs over the basic necessities of life, like food and water and shelter, okay? A lot of these addicts will choose to live on the street and use drugs rather than live in a house with shelter and, food and a stable job and all that. They will choose the drugs over all that other stuff, okay? It's very, very, very powerful. Okay, overdose. Overdose does not mean dead. Okay, when you hear somebody, they overdosed or whatever, it just means that they used too much, right? There's a toxic amount of that narcotic in their body. It does not mean that they are dead, okay? All right, so we kind of covered this already, but signs of an overdose. Okay, we have small, constricted, pinpoint pupils, falling asleep, losing consciousness, slow, weak, or no breathing. Okay, choking or gurgling sounds, limp body, cold or clammy skin, or discolored skin, especially in the lips and the nails. Their lips and nails may have a bluish color, and this is from the lack of oxygen in their blood, right? And their breathing is diminished to a point where they're not getting enough oxygen, then you might start to see some bluing in the lips or even the nails. Okay, so this device down here, who knows what that is? Anybody in here? That's Narcan, right? So Narcan is what we use to fight the effects of an overdose, okay? Narcan is an extremely effective drug, and it's saving lives every single day. Officers are carrying it now, the paramedics have it, the hospitals have it, and it's saving people every single day, okay? We're gonna go over Narcan at great length here in just a moment. Okay, so another thing that we see sometimes is people will mix fentanyl with things like alcohol or maybe even other drugs, okay? So the effects of fentanyl can be amplified by taking it with other substances, okay? If they're mixing it with alcohol, okay, well, alcohol is a depressant. Fentanyl is also a type of depressant, right? So you have two depressants on board. So that person's level of consciousness may be severely diminished, okay? They may be falling asleep or you may be unable to wake them up, but the effects of the fentanyl could be amplified by the alcohol, all right? We've also seen people mix them with other types of drugs, okay? Maybe a CNS stimulant such as methamphetamine, okay? And what this does is, since meth is a stimulant and fentanyl is a depressant, okay, now these narcotics are going to kind of compete with each other in your body. And what it could do is it could convince the user that they can actually use more than they should be using because they're not feeling the very drowsy effects of the fentanyl due to the methamphetamine, which is trying to bring them back up, okay? So this person may overdose more easily when combining it with things like a CNS stimulant like methamphetamine. All right, so Narcan. Narcan is actually a brand of medication. The generic name for the medication is naloxone, okay? There are other brands of naloxone, but Narcan is by far the most prevalent. And basically how Narcan works is, remember those opioid receptors we were talking about earlier? Okay, well Narcan has a much stronger, it binds much stronger to the opioid receptors, okay? So strongly, in fact, that it will actually kick out all the opiates from your receptors and completely block all the effects of the opiates, okay, by binding to those receptors, okay? Just because somebody has had Narcan does not mean that they're totally out of the woods, okay? Narcan only lasts typically about 30 to 40 minutes, somewhere in there, and the opiates will last much longer. So when somebody gets a dose of Narcan, we still need to make sure that this person gets medical attention, okay? They still require a couple hours of observation at a hospital to make sure that they're gonna be okay. The last thing we want is for someone to get Narcan and then they get up and walk away, and then 30 minutes later, they're back having an overdose emergency, okay? Now, with that being said, Narcan, like I said, is amazing. It works really, really well. I've personally witnessed multiple people who are having an overdose emergency. They're on the ground, they're dying from an opiate overdose. They get Narcan, and as little as 60 seconds later, they're sitting up talking to you. Okay, so it works really, really, really well. Okay, so Narcan, it's pretty easy to use. Let me go back one slide here. This little nozzle sticking off the top, that basically just goes in their nostril, and then you take your thumb and you depress the plunger on the bottom and you actually deliver the spray into their nose, and now they have Narcan on board, right? Simple enough. Okay, if you suspect someone is experiencing an overdose, find an adult immediately so Narcan can be administered, okay? This is the message that we gave to all of the students that we've given this presentation to, okay? But for you guys, if you suspect someone is having an overdose, what they need is Narcan, okay? And if you don't have Narcan, the people who have it, you gotta call 911 for them, okay? So call 911 immediately if you think someone is having an overdose so they can get Narcan. That is what's going to save their life. Okay, so I wanted to include this law here, okay? Health and Safety Code 11376.5. The numbers aren't that important, but the content is important, okay? So I'll just read it to you. It shall not be a crime to be under the influence or to possess for personal use a controlled substance or drug paraphernalia if that person in good faith seeks medical assistance for themselves or another person experiencing a drug-related overdose and the person does not obstruct medical or law enforcement personnel, okay? Basically what that means is if you are calling 911 or you are seeking help because someone is experiencing an overdose, you will not be held criminally liable for possessing narcotics or possessing narcotic paraphernalia or for being under the influence of narcotics, okay? And the reason I wanted to include this is because I don't want people to be afraid to call 911 when someone that they know is having an emergency, an overdose emergency. Okay? I don't want them to be worried about, hey, are we all going to get arrested if we call 911? Okay? This law will protect them. Okay? So if there's, narcotics on the table when the paramedics arrive and the police happen to walk in with them, the worst they're going to do is just take the narcotics for destruction. Nobody's going to jail, okay? It is important to note that it does not protect people from narcotics sales, okay? That is still an enforceable crime. So this protects possession of the narcotics, of the paraphernalia, and being under the influence only. Okay, so who here has ever heard of the myth that just touching fentanyl will kill you? Okay, got a couple hands. All right, so while fentanyl can be absorbed through the skin, it would take hours to absorb a lethal dose, okay? The biggest risk is gonna come from like airborne fentanyl, right? So if someone actually took a handful of powder and threw it up in the air and you were to breathe that powder in, then you might be looking at a problem here, okay? But just, getting a little bit on your finger is not going to kill you. They actually make fentanyl like dermal patches. They prescribe dermal patches for pain, and it takes hours to absorb all the fentanyl in that patch, right? So just touching a little bit of fentanyl isn't gonna, go straight through your skin and now you're gonna fall over dead. That's not how it works. Okay, another myth that I've heard is that if you give someone Narcan and they're not experiencing an overdose from opiates, that Narcan will hurt them. That's not true. Narcan won't hurt anybody unless they have an allergy to Narcan, but that is a very, very rare thing for someone to actually have an allergy to Narcan or naloxone. So if someone is unresponsive for maybe a different reason and then they get Narcan, it's not going to do anything. Not a thing. They'll be just fine, okay? Okay, so Texatip. Have you guys heard of Texatip before? Yeah, okay, so this is something that the school district has put in place, and is basically a way for students and parents to send information to the staff, okay? And over here on the right are all of the phone numbers for each of the campuses, okay? But you can use Texatip to send information about the use or sales of narcotics. It's important to keep in mind that these lines are not monitored 24/7, okay? And they are not intended for emergency use, okay? If what you are experiencing is an emergency, just go with 911, okay? If you can forget about Texatip. But you can also use Texatip to report things like abuse or bullying, depression, fights, thefts, threats to campus safety, safety concerns about a peer, suspicious activity, even vandalism, and whatever else you think that the staff needs to know, okay? Okay, so big picture, what do we want you guys to take away from all of this? Number one, fentanyl is extremely dangerous, okay? And it's killing a lot of people every single day, okay? And it can look like legitimate medication, and so I would advise against taking pills from any unverified sources, right? Unless you got it from a pharmacist, I wouldn't even take that pill, okay? Illicit fentanyl is responsible for countless deaths among teens and young adults, okay? Call 911 if you think someone is experiencing an overdose. Administer Narcan if they're unresponsive, okay? Have a conversation with your children. Report any information about the use or sales of illicit fentanyl or the drugs. Utilize a text tip because you could save someone's life, okay? Now, Trinity, going back to Trinity, okay? What happened to Trinity is she thought she was buying oxycodone, the M30 pill, okay? Instead, what she got was an illicit fentanyl pill, and that ended up killing her, okay? So that is another one of the takeaways that I want to give everybody here, is that it's not just addicts who are dying, right? It's good kids, good people who maybe just made a mistake or wanted to try something and it took their life, okay? Another thing that I want everyone to take away is that as parents, okay, you absolutely have the right to go through your child's electronic devices, phones, iPads, computers, all that stuff, social media, okay? And you should. You should be doing that, okay? You should know who your child is talking to. You should know who they're hanging out with, okay? You should know what they're talking about. You should know all of that stuff, okay? You absolutely have the right to be nosy in your child's life, and I think you should, okay, to help protect them from stuff like this, right? This is kind of scary. So you should be checking your child's electronic devices and knowing who their friends are and knowing who they're hanging out with, okay? With that being said, does anyone have any questions for me?
But it was talking about 2021, and we were shown a picture of the overall cities with the fentanyl usage, and it had a numbering like 1 through 4. And I noticed, like, in Yorba Linda, it was like at a 1. And then I noticed in Placentia, it was at a 3. And I'm wondering what's going on. Like, why are we having such a prevalence in Placentia? And what are we doing to mitigate this? I mean, I see that we're bringing awareness with FAIR, and we're presenting it to our students, and we're presenting it to parents, but how is, like, why is it so big right now in our city?
So I think a lot of that is going to have to do with, and this is a study that you were talking about that they did, or?
So it was, I'm trying to find it, I took a picture of the graphic, but we had a training.
Yeah. And this is just general fentanyl use, right?
Fentanyl, and then also Narcan, because as an educator, I was trained on how to administer. So it was just a graphic talking about opioid-related overdose rate by zip code 2019 to 2021. And then there was a death rate per 100,000 persons, and then it had like a
Got it. Okay.
Placentia was like that third color, so like 47.5 to 67.1 for that area.
It's higher than the surrounding cities, is what you're saying, right? Okay, so a big reason for that is Placentia is unique in that we have a homeless shelter, okay? And like I was talking about earlier, drug use in general is very popular amongst the homeless population, but especially fentanyl is very popular, okay? Fentanyl is very cheap to buy, it's cheap to make, and many of the homeless community are using fentanyl. And many of the homeless community are unfortunately losing their lives to fentanyl from overdose, okay? And we have the only homeless shelter right now in North Orange County, other than I think it's Buena Park has one. But yeah, we're it for the surrounding cities right here. So our homeless population in Placentia is actually higher. We have quite a few of them, and like I touched on earlier, they do use fentanyl. So I don't know the definitive answer to your question, but if I was a betting man, that's probably the reason why our number is higher than, say, Yorba Linda, right? Because Yorba Linda does not have a homeless shelter, and I'm willing to bet their homeless population is not what Placentia's homeless population is. Go ahead, ma'am. So when we're talking about our students at the district, I don't think any of them, or at least I would hope a very small number of them, are actually seeking fentanyl, okay? What they're seeking are other drugs, right? Like what Trinity was trying to buy, the oxycodone, right? She wanted to go to a party, take an oxycodone pill, feel good, have a good time with her friends, and then go home and move on with her life, okay? But because she was sold the fentanyl pill, and she did not know that, when she took that pill, I believe that she thought, like, hey, this is oxy, right? This is just a little party drug, I'm gonna feel good, and it's all gonna be good. But what she got was fentanyl, and it killed her, okay? That's why, when I was talking about the dealers who are, openly advertising, they're telling these kids, like, hey, I'll sell you Adderall, sure. I'll sell you Oxy, sure. But what they're actually selling them is a pill that they have made to look like those prescription pills, but it's actually a fentanyl pill, okay? And the reason they are doing this is simple. It's money, okay? Prescription pills are not easy to get a hold of and then sell, right? It's easier to make fake fentanyl pills and make them look like the real thing and sell those, okay? It's easier for them to do that, okay? And if this dealer sells to, say, 20 people, and 3 to 5 die from an overdose, they're fine with that, right? That means they have 15 new return customers that are gonna keep buying their product and coming back for more. They don't care about the 3 to 5 that died from overdose. What they care about is money, okay? So what they're doing is they're basically tricking people into thinking they're buying Oxy or Adderall and then selling them the fentanyl instead in hopes that they'll like it, come back and buy more. That's why. Does that answer your question? No. Is this all the other things you're telling me are those also drugs? Yes. So Adderall. Oh, yeah. So mental health has a lot to do with the reason why people would want to start using drugs in the first place. Just trying to go back to that slide with the, there you go. Those are the drugs I was talking about, okay? But yes, mental health does have something to do with why people choose to use drugs initially, right? But then normally it's the addiction that takes over, and then that's the reason they continue to use it, okay? But also, there there are people out there who just wanted to try it just for the experience. Like, hey, you know what, I wanted to try this particular drug or whatever. And they may not have a mental health condition at all. Okay, it really depends on the person. It's a very individual thing, the reason someone would want to start using drugs, but the reason they continue it is almost always because they have a crippling addiction to it. Go ahead. Mm-hmm.
3 jars, one with a lethal dose of heroin, fentanyl, and there was another one, and I was wondering what that drug was.
Oh, yeah. So let's see if I can go back to it. Sure. So she asked, on this slide, there were 3 vials, as you can see over there on the right. She said there's heroin, there's fentanyl, and there was one more, and she didn't know what that was, and she's asking what that was, okay? That last one over there, that says carfentanil, okay? It's basically another type of synthetic opioid, and it's even more potent than fentanyl is, okay? Luckily, we're not seeing too much of the carfentanil. Most of what we see, if we see illegal opiates on the street, it's going to be fentanyl, okay? We used to see heroin a lot, but now personally, I haven't seen heroin in quite a while. It's almost always fentanyl now when it's opiates, okay? But that over there is carfentanil. Go ahead.
If a teenager takes just one pill of fentanyl, how long do they have to get help, to go to the doctor?
Okay, so he's asking if a teenager took a pill, a fentanyl pill, how long would they have to get help or to go see a doctor? Now, this is all going to depend on some things, right? How much fentanyl was in that pill that they took, right? Because these pills are not made in a controlled, laboratory approved by the FDA. These pills are being made in, a makeshift laboratory in someone's garage or in someone's house. So the amount of fentanyl in each pill is going to vary, okay? And if they're taking a pill, the pill has to be digested, right? That's how it's going to be absorbed into the bloodstream. It's going to go through the digestive system. So typically, you're looking at about 30 minutes to maybe like an hour before things start really peaking, and they might get themselves into trouble if it's a dangerous dose. So yeah, somewhere in there, about 30 minutes to an hour, depending on some other conditions. But yeah, about that amount of time. If they decide to use in another manner, so if they decide to smoke it or inhale it, then the onset of those symptoms is going to be much, much faster. We're talking, 5 to 10 minutes before they're going to be in trouble. Okay? Yes. So we do have Narcan at all of the campuses now, sir? Yes. So we have Narcan at all of the campuses now, and there are staff that have been trained to use it at those campuses. So yes, we do have Narcan at the campuses, and the district is working on getting a lot more to stock at the campuses. Yes, sir. Absolutely. So he's asked me to touch on where you can get Narcan, and Narcan's actually available over the counter now. You can go to any pharmacy and you can ask for Narcan, and they will sell it to you. It's a little bit pricey. Last I heard, it was about $50 for a box containing 2 doses of Narcan. But if you Google free Narcan, Orange County, then you will see some resources come up, and that could be a way for you to potentially get your hands on some Narcan free of cost. Okay, but yes, you can get Narcan over the counter at any pharmacy nowadays. The Narcan. Yeah, so you're talking about the shelf life? Shelf life. So last I heard, Narcan was about 5 years for a shelf life. So after 5 years, it will expire. But yes, you have about a 5-year shelf life for Narcan. Yes? Narcan? Narcan will last about 30 minutes. Oh, fentanyl. Okay, so you're asking how long the effects of fentanyl will last? Okay, so yeah, if they take fentanyl by pill, you know, we're talking about 30 minutes to an hour before it starts peaking, and then you're probably looking at about a couple hours after that, maybe 3 to 4, before they actually will be coming down and not being under the influence of it anymore. But yeah, typically it's going to be a couple hours, so it lasts a lot longer than the Narcan does, right? So it's important, give Narcan, make sure that they're still going to be under observation for a couple hours to make sure that they're going to be okay. Yes, sir.
Is fentanyl being used, to your knowledge, as a form for suicide?
I'm sure it is. I'm sure it is. I personally have not come across an example of somebody intentionally taking their own life using fentanyl, but I'm sure, you know, people have been or have tried that. I've seen people try to take other drugs to try to take their own life. So I would assume that people have tried using fentanyl as well. Go ahead.
Are officers actually going to the schools during school hours and teaching these kids about fentanyl?
Yes. So he asked if we're actually going to campuses and teaching the students about fentanyl. Yes, we are. My agency, me and my old partner, SRO, we actually went to Valencia High School as well as El Dorado, and we gave a version of this presentation to the students, to all the students at those two high schools, as well as the students at El Camino High School. So yes, we have been showing a version of this presentation to the students at the high schools, and we have plans at the start of the new year to possibly go and do the middle schools as well. No, sir, we have not done middle schools yet. Anything else? I would say it's probably a little too early to tell. We just got done with these presentations at the high schools last month, so we wouldn't have enough data to really be able to tell at this point. But I'm hoping the answer is yes. Anything else? All right. Well, did you have one? So yes, that's actually happened, where someone has so much fentanyl on board that they need 2 doses of Narcan to save their life. Yes, that has happened. But you know, that brings me to a great point. If you ever find yourself treating someone for a fentanyl overdose and you give them Narcan and it's not really working, you're absolutely okay to just give them another dose. So you can give them both the doses in the box. It won't hurt them, and it could save their life because they may have too much fentanyl on board. Good question. Anything else? Okay, well, thank you everybody for joining us tonight, and hope you have a great night.
Thank you again. I was just going to say, let's give a round of applause for the sergeant with his wonderful presentation. And again, just as a reminder, the same presentation will be offered at Thursday night at Valencia High School. So anyone that missed it tonight, if you think they would benefit from the information, we would encourage you to have them go to Valencia this Thursday night in their auditorium at 6:30. Same start time as tonight. But we thank you for spending time with us this evening, and I look forward to continuing this work during the school year. So, yes. Yes, well, now that we have the recording tonight, I understand that we had quite a few listeners remotely listening to the presentation, so we thank them for their participation. But now that we have a recorded version of the presentation, we will be posting it on our YouTube channels through the district office as well as the city. So people will be able to access the information at that time. If you wanted to rewatch it or share it with somebody else, you certainly can send those links to them to be able to access it. So with that, we wish you a great night, and thank you for all the thoughtful questions and for your time this evening. And we look forward to seeing other families, the rest of our families, hopefully on Thursday night in a couple nights. So thank you very much.